Thank you all for joining our session today, Becoming a Mental Health Advocate for Mental Health Reform. Today's a special day, Martin Luther King Day, a day of service. My name is Dr. Ben Miller, and I'm the CSO, Chief Strategy Officer for Wellbeing Trust, a national foundation that focuses on advancing the mental, social, and spiritual health of the nation, as well as the advisory board chair of Inseparable, a new national policy organization committed to advancing robust policy on mental health. Our two organizations, Wellbeing Trust and Inseparable, came together in partnership with many of our friends, who we'll let you hear from in just a minute, to offer up a training that we felt was needed. And it's something we hope today you enjoy as another way to serve. As Dr. Martin Luther King said, everyone can be great because everyone can serve. There's power in service and can not only benefit the person doing the serving, but the person receiving the service. It's my honor today to be able to kick off today's session, really a service opportunity of sorts, on mental health and advocacy. We often think of policy and advocacy as someone else's responsibility. We sometimes think it could be too complicated, too confusing, and it actually can be sometimes. However, without the power of your voice, oftentimes policy gets made in ways that may not necessarily be in the best interest of you or the issues you care about. And today is about that. It's about you. It's about mental health, and it's about service. And what a time to talk about service and mental health. Our previous and likely incoming Surgeon General, Dr. Vivek Murthy, wrote about this so eloquently, where, quote, service is a form of human connection that reminds us of our value and purpose in life. Giving and receiving both strengthens our social bonds. Checking on a neighbor, seeking advice, even just offering a smile to a stranger 6 feet away, all can make us stronger, end quote. I don't think that Dr. Murthy knew when he wrote this in his book Together that the 6 feet would become almost a daily challenge for us today. Yet here we are in an almost perpetual state of 6 feet away, experiencing what it's like to lose a sense of normalcy that we once had prior to COVID. And the data show our struggles with increases in depression, anxiety, drug overdose deaths, and overall stress. This pandemic has brought mental health to the forefront of all of our lives. But this is a gentle reminder that prior to the pandemic, we were not doing so great with our nation's mental health either. We were losing more lives to preventable causes than ever before, and the nominal investment in mental health didn't really allow for us to talk about anything other than keeping the lights on. We need more if we want to radically reform what's needed for mental health. People had to wait too long to find care, if they could find care at all. Insurance companies often denied much needed care or forced people to pay out of pocket. And while our culture has become more open to talking about mental health, there remains a stigma attached to it that's less and less social, but remains entrenched structurally. In fact, last year, Viacom, CBS, and Wellbeing Trust partnered with the Benenson Strategy Group to conduct an online survey of Americans and to really understand their attitudes towards mental health care. And we found that voters across all party lines wanted their representatives in Congress to come together to make mental health care more available and affordable for all Americans as a key part of addressing this pandemic. When asked whether elected officials should be focusing more or less on mental health, more than 9 in 10 voters in both parties said more. Change has been incremental, which has not kept up with the profound demand for more. Approaches that make it easier for us to get the help we need. For our country to truly tackle these complex, deeply rooted problems, we need to transform fragmented and disjointed clinical and community systems and bring them together in more integrated ways. Some of the trends we've seen on deaths from substance misuse and suicide are symptoms of broader problems. If we treat only the symptoms, more and more people will be at risk and die needlessly. So this is what we're going to do today. It's all about us doing something big together. It's about you. Our session today is about why advocacy is important, what it looks like, and how to do it. We know that people are coming in at different levels of experience. We're aware of that. We might have seasoned pros and brand new folks to the field. And in doing so, it's our way to give us a new opportunity to talk about what's not working, to think bigger, to consider ways that we can create an approach to mental health care that works for us all. But to do that, to have policy take action on our vision, we must advocate. And what better way to provide service to our families, our communities today on this day of service than to learn how to do just that. So to start our time together, it's my great privilege to introduce you to our first speaker, former Congressman Patrick Kennedy. As many of you know, during his time in Congress, Patrick Kennedy didn't just write policy. He wrote some of the most seminal policy for mental health and addiction our country has ever seen. He was the lead author of the landmark Mental Health Parity and Addiction Equity Act, which many of you I probably know requires that health insurers cover treatment for mental health and substance use disorders the same as illnesses of the body. He's the founder of the Kennedy Forum, which helps unite advocates, policymakers, and businesses, all in service to advancing practices and policies in mental health and addiction. And while I could spend hours talking about how wonderful Patrick is and the various committees and awards he's received, I will only just kind of stop here and turn it over to him and let him tell you all the great things that he's doing and why it really matters for us to get involved in mental health and advocacy. So Patrick, I'm going to turn it over to you. Could you tell us a little bit about this moment and why service is a solution to so many problems, and how can we take action on mental health, and why advocacy is everyone's responsibility?
Well, thank you, Ben and LaShawn and Kavita, for your tremendous advocacy. Wellbeing Trust has really advanced advocacy for all those who are listening. Wellbeing Trust has partnered with both us at the Kennedy Forum, University of Pennsylvania, on 2 guides for advocates to refer to in order to know kind of what areas they might want to, push in terms of changes in public policy. So you've given us the tools, Ben, and thank you for that. I became the #1 sponsor of parity, the first signature on this bill that frankly just covers illnesses of the brain, not a revolutionary concept. But of course, it wasn't passed until 2008. And I might add, it wasn't passed because we woke up in 2008 and said, oh, wouldn't it be good to cover mental illnesses? It was passed in 2008 by that sausage-making process you hear about in Congress. In other words, Congress didn't even know they were passing the parity law when we passed it. They were passing, yes, the parity law, H.R. 1424, but what people didn't know that the underlying bill was parity was because our great friend, Senator Chris Dodd, who was chairman of the Banking Committee, decided to write the whole $700 billion toxic asset relief program, the otherwise known as the Economic Stabilization Act, into our parity law to allow it to pass. So when people passed it and voted for it, and when President Bush signed it into law, I challenged that many congressmen to actually know that the underlying bill was guaranteeing coverage for depression, alcoholism, addiction, and mental illness. I'm only saying this to make the point that advocacy has been anemic at best. However, this terrible crisis of COVID is really not just a crisis of a viral pandemic. It's a mental health and spiritual crisis. The isolation, Ben, that you referred to at the outset really has precipitated an even worse mental health crisis, understanding, as you pointed out, we already had an epidemic of overdoses and suicide, and this, I think, really, but by everyone's estimate, is going to compound that unaddressed public health crisis beneath the COVID crisis. I would say for all of those who are here on Dr. King's birthday, he said famously that of all forms of injustice, injustice in healthcare is the most shocking. And perhaps if he were alive today, he would say of all forms of healthcare injustice, the injustice in mental health and addiction is the most shocking. Because mental health and addiction, as we all know, is not treated as part of healthcare. And that is why our advocacy work needs to be multifaceted. And I know you're going to have Kavita take you through some policy actions that we can work on. And as I said, Wellbeing Trust has laid these out, and LaShawn can give you some terrific organizations to be part of. But for those of you who, like me, are in recovery, service is not something altruistic. It's not a selfless act. It's actually a very selfish type of act, because it's in giving to others that we lose ourselves. And in losing our own self-centeredness, we become free of that terrible angst that often paralyzes our own lives. And the real beauty in the solution to this epidemic is that we can repurpose all of those who are now suffering if we are really thoughtful and mindful about bringing them in and making them understand that their suffering is not in vain. They can turn their own life's experiences into lessons to help others who have yet to obtain recovery. And as we know in recovery, recovery is a spiritual mission. And frankly, on this Dr. King's birthday, it's helpful to remember that the way Dr. King won the civil rights battle was because it became a spiritual battle. It started in the churches with the fundamental belief that we were all God's children and that human dignity at all levels needed to be respected. And it was from that basic belief in nonviolence and love for one another and the spark of divinity that is within each of us that nonviolent movement that transformed this country, which we celebrate today, was born. We can take a page from Dr. King and we can say to ourselves, for those of you who are like me, who grew up after the great civil rights fights, after the great anti-war battles, after the great expansion of rights for those in the LGBTQ community, for gender rights and so forth, we have an opportunity to take on the mantle of a new kind of civil rights fight. It's for integration of mental health and addiction into both healthcare and into all facets of our society, so that we no longer criminalize mental health, we no longer marginalize those who are suffering from these illnesses, and we no longer tolerate a system that would treat our loved ones as second-class citizens. With this, I'd like to turn it over to Kavita. Thank you, Kavita, for all of your inspirational leadership in this space. And my father absolutely adored you, how brilliant you were, how instrumental you were in helping him write national public policy in healthcare, and how proud he would be to see how much you've done in the course of your life, having gotten a real fundamental start in his office. And he was so proud of how many people he was able to bring into Washington who were the best and brightest, and you were certainly amongst those. So thank you, Ben, and I'll turn it back to you guys.
Thanks so much, Patrick. And we appreciate your leadership, your insights, and the reminders of the importance of service and the roles that we can play in making a difference. You're a tremendous example of this. We know you have a lot of events today, so thank you for joining us and challenging us to think bigger and take bolder action. So be well, my friend. Thank you. And so now let's turn to someone who, like Patrick just did already for Kavita, really doesn't need an introduction. Dr. Kavita Patel is currently a primary care doc in Washington, D.C. She's also a non-resident fellow at Brookings Institute. She's held a lot of really important titles, as Patrick alluded to, but including being the previous director for policy for the White House under President Obama, and a senior advisor to Patrick's father, Senator Kennedy. Kavita is a dear friend and has forgotten more about policy, especially complicated policies like those found in Medicare, than some of us will ever know. So Kavita, Patrick set you up beautifully, but just tell us a little bit about what's going on in your world, what you think, why advocacy matters for advancing policy, and maybe before we get to LaShawn, talk a little bit about tactics or any advice on what you think might help us move the needle for mental health.
Yeah, thank you. And what a generous introduction by both of you. I just want to thank the Wellbeing Trust, Inseparable, and all the people who are on the Zoom today. And I still think of him as Representative Kennedy. It's going to be hard to get that out of my head because he always will be to me. He's right. I learned anything I know about advocacy from the greatest, Senator Edward M. Kennedy, who taught us that our jobs were really to work in the interest of the American people. And I think that matters. I was listening to a TED Talk last night from the three co-founders of the Black Lives Movement Matters, and one of them, Alicia Garza, who kind of had the viral Facebook post that ended up kind of being the genesis of like the phrase Black Lives Matter, said something that resonates with me, and I just want everyone hopefully to kind of see it and resonate with you, is that leadership matters, but the real kind of sign of leadership is not necessarily kind of the person that steps forward, but the people who kind of carry with them every day and in small ways kind of making a difference, and not necessarily always who's kind of on, you know, the person on the stage at the podium, the, you know, four of us on a Zoom might seem like we're kind of leaders, but our true job is to help everybody feel like they have their place on the stage at the podium, because you do. And I think that resonates with me, just because when I worked for Senator Kennedy or any public service kind of time in my life, it was never about me. It was always, and it was never about him. It was always about kind of what's the best thing for the American people. So I feel very strongly about that. I want to offer Ben some very, I'll give very candid remarks. I worked as a staffer in the Senate office, and I'm a physician, as you mentioned. So I see it from kind of both sides. I'll just identify ultimately what I learned, kind of not just on years kind of in the Hill and in government, but I think I've seen it now that I'm in the delivery side. Ultimately, what policymakers want is something that they can help. They need the message combined with kind of the underlying like facts on the ground, so to speak, to make it clear to people what the point of that policy is. And I'll give you a concrete example. All, by the way, with the most valuable, don't worry what anybody tells you, the most valuable commodity in government on the Hill is time. So anything you can do to help leverage that most valuable commodity, which is time, and also offer something that's concrete to these legislators, are exactly what they need. And I think ultimately what we have to do as advocates is take what we know, which most of us are kind of subject matter experts, so we know too much. And you have to remember that we might be experts in a field, everybody else is a generalist. So we need to be able to translate expertise, pair it with what I call real people stories. In the White House, in the Obama White House, we would refer to them as RPs, real people. We would always ask, like, what do the RPs think? And I didn't really process what that was, but what do real people think? So I had to find this fine balance between that story, that family, that picture. Senator Kennedy did it brilliantly. We would have a story about a child who died because he didn't have dental access, for example, an adult who committed suicide because we did not have mental health parity. But he would use that story to then talk about the really kind of important policy points. We needed to really understand what parity meant. We needed to add benefits into the Medicare and Medicaid program for mental health. We needed to add, in the case of dental, we needed to add a dental benefit into the CHIP, the Children's Health Insurance Program, which he helped start. Those were tools. And we went to advocates, oftentimes as policymakers, we would go to advocates and say, I need you to help us figure out how to sell this policy so that Republicans will do it, or so that blank will do it, or the House will do it. And that's an opportunity. Sometimes you feel as an advocate like, I'm just being used. No, that's an opportunity. You've got a captive audience. You can do it reactively and be able to and work with them, remembering time is of the essence. Anything that you can offer in terms of concrete kind of language. You don't have to be a lawyer. You don't have to be a Senate staffer or former Senate staffer, but they need things that are very simple. And it's because their job, my job used to be to take that and turn it into the legislative language. I also want to offer, we're in a new era always with social media. Social media can be incredibly helpful, and it might not be helpful in certain instances. So there might be a reaction to have a grassroots movement like Black Lives Matter kind of bubble up into policy. That's incredibly important. But we need to think about also then how to have a cycle so that policies, which might not seem like the top of mind, and let's use right now as an example, COVID, everything is about COVID, 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 COVID. And everything around mental health has been, whether it's right or wrong, put under kind of a COVID lens. And that can be frustrating. And I'm on Twitter, Ben's on Twitter. Sometimes we're trying to elevate some of those mental health issues, but it can be hard when all of Twitter is on fire all the time about COVID. Today it's the vaccine distribution. Next month it'll be about something else. So use the social media to acknowledge kind of where we are, but also remember that when you're working with policymakers, they don't necessarily respond to something that went viral on Twitter. They're going to respond to how you can help mobilize an audience, maybe through social media, to support their policies on the Hill, to support their regulatory actions in the executive branch. And I will say that the other thing I learned is how much, and I think LaShawn's going to do an incredible job to try to teach us what we can and can't do and understanding kind of how the executive branch and legislative branch work. But I think that key there is also using these moments, and in relationships matter in those moments to respond. And then I'll just close, Ben. I just want to, I'm gonna be off camera, but I'm gonna be around and maybe we can do some Q&A. I really feel strongly like you have to kind of, I have to do this every single day, by the way, because I get up, I won't lie. I've spent a lot of my time trying to integrate behavioral health into primary care, sometimes successfully, sometimes unsuccessfully. And I get really depressed at the progress I have not made. And I think, one, you have to acknowledge that and be okay with it. But then two, you have to think about your purpose. I have now gotten comfortable articulating that my purpose is to absolutely make sure that when I leave this earth, that we have a better mental health care system, and that we don't call it a mental health care system, that it's just part of our system. I want that to be my why. And as an advocate, as an individual, as an organization, try to hone in on what's your why. It'll keep you going, because there are probably 98% of my days are full on rejections, emails that don't get answered, calls that don't get returned, and it can be hard. So I'm speaking to a lot of you who are here for a day of service. Service yourselves by reflecting on why this matters. And it does matter, no matter who you are. Even that like handwritten note that, you know, helped to compel someone to come forward and get help or offer assistance matters. And think about kind of what motivates you. So I really think that, again, I think this is a topic I could talk about all day, every day, but I really want to thank, you know, the group for bringing this together. And hopefully this is the start of many conversations that can offer service to the American people and beyond. So Ben, I'm going to be here and I'm excited to listen and learn.
Thanks so much, Kavita. I love that notion that it's never about us, it's about others. You and Patrick have offered this inspiring call to action I think we all must embrace. I especially love you calling out what policymakers want, that the message combined with the facts. That's so important. I think it's going to be one of the skills that we will talk about in a minute. And I also finally appreciate you lifting up the commodity of time. Folks are very busy, and so sometimes being able to really use that to our advantage is important. And so thank you for closing with your why. We will all be better if we can achieve that vision that you're working towards too. So thank you. All right, so for our training today, I'm going to turn it over to LaShawn Francis. LaShawn is many things, but I like to think of her as one of the most savvy policy operatives I know. LaShawn is currently the Associate Director of Health Collaboration at Children Now. Prior to joining Children Now, LaShawn was an Associate Director at the California Medical Association, and she's done the deep end wonky stuff like working with the Legislative Analyst Office. So she can talk about this from all different levels. So when we were thinking today about who could come in and offer a training for our day of service, I could think of nobody better than LaShawn. So LaShawn, thank you for your service to us today by helping us understand this a little bit better, and I'll turn it over to you.
Thanks so much, Ben. That was such a generous introduction, but I am really, really excited to talk about this today. I feel as if I talk about this very often with folks, just in everyday conversation. And, you know, the idea of being an advocate, I think sometimes feels daunting to folks, and it's unreachable. But my hope with today's conversation is that anyone can be an advocate. You don't need a law degree, you don't need a master's, you don't need to be a physician. You can really get involved in understanding problems and identifying solutions. So that's what I hope to spend some time talking about. And then maybe there'll be some time at the end where we can just bounce some ideas back and forth and maybe get some questions answered. Next slide. So I know that today is the day that we're focusing on celebrating MLK, and you know, in service to him and his life and his life's work, I really enjoy this quote. MLK Day has always been looked at as a day of service, and this is a quote from one of his last sermons that he gave at Ebenezer Baptist Church in 1968. And he said, Everybody can be great because everybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You only need a heart full of grace, a soul generated by love. I think if you're starting there, you're starting from a great place. Next slide. So here's the run of show for today. We're going to briefly talk about what advocacy is. We're going to go through the steps necessary to engage in advocacy efforts, like defining the problem, like coalition building. Then we're going to leave some time for examples from the field. And I hope to also leave you with some mental health networks and resources. Generally speaking, I think you'll find that advocacy across the board isn't much different depending on, regardless of your issue area. But I do think there's some things that are unique to mental health, and we'll talk about what those things might be. Next slide, please. Very simply, advocacy is the act of supporting, defending, or arguing for a specific cause or issue with the intent of bringing about change. Now, most people are used to being advocates in their everyday lives. You might advocate for your child at school. You might advocate for yourself in the doctor's office, right? But the advocacy that we're really going to be talking about today is about implementing policy change, right? So what laws, rules, regulations, policies, and practices need to be changed? That could be on the local level, on the state level, on the national level. It's kind of the same process with different players. So that's the kind of advocacy that I'll be focusing on today to really implement and to think about what skills might be necessary to be a strong advocate. Next slide. Understanding the problem. And this is a really, really big one. I see this all the time in mental health, right? And this is the problem of advocating for things that no one asked for. And I don't know how else to say that, but the idea, there's a few things here, right? The first is the grassroots understanding from communities and from individuals, particularly racial and ethnic communities, that really came up with the slogan, "Nothing about us without us." And that slogan was really to identify that there were policies that were being introduced that those communities didn't ask for. So if you are advocating, say, on behalf of, the Native American population, it's important to talk to those representatives in that community, right? And have a better understanding of what it is that is needed. I remember a time I went to a community meeting some years ago, and I went to this community meeting with the intent on learning what the community needed. However, before I went, I was so sure that I knew what that community needed because I read about the problems, right? So I spent a good amount of time understanding the issues around food insecurity and access to health coverage and the need for better mental health supports in schools. And when I got there, it was a really humbling experience because the thing that the parents were talking about the most were the need for streetlights. And I had never thought about streetlights. That is not what any of the research told me. But it's not to say that what I read wasn't important. It wasn't to say that they didn't care about food insecurity or healthcare access. But for me, it was really a re-education on what they cared about most, right? So as you're understanding the problem, I think it's also good to understand what's most important to this community that I'm here to serve. Then you can look at what the research says about that issue, right? So, the next step for me in that situation would have been to leave there knowing that streetlights were the most important issue, right? And if I'm really here to be in service of community, my next step would have been to do some research on why streetlights are so important. What do the academics say about, the importance of streetlights and the safety around streetlights, et cetera, right? So really, you do need the combination. I think what happens sometimes with advocacy is that oftentimes we rely primarily on what the research says. And it's not to say that we shouldn't understand the research and really welcome the research, but research sometimes is very limited to what data is available and the interests of the researcher. So if you're really trying to understand what communities want and where they define the problem, the first place you have to go is to the source. Next slide. Identifying solutions, very similar thing here, right? So really understanding not just what you might think is a good, example or a good response to the problem, but hearing, what folks were saying they would find to be the most helpful, right? So I always see this mismatch between the problem and the solution, and it's not done intentionally. I think what happens is we tend to gravitate towards solutions that we think might be easier to fix, right? As opposed to solutions that the communities actually want or that folks are actually looking for. So if I had come away from my community meeting where parents said they wanted streetlights, and I said, you know what, it's too hard to convince city representatives to pay for streetlights. How about we just give families flashlights? I don't think that they would have thought that was a sufficient response, right? So really understanding what solution is going to be best by asking folks what it is that you want to see, right? They actually want poles going up on every block or every other block so that their kids can be safe walking home from school. And then what does the research say? Is it true that you're safer if you have streetlights, right? And I'm going to use the streetlight example because it's a very simple example, right? And I think sometimes when we talk about mental health and we get into issues of parity and we get into issues of payment reform, it can get very complicated, right? But really thinking about what solutions are matching the problem is a skill no matter at what level you're talking about the issue at hand. Next slide, please. So after you've identified your problem, right, and you have thought through your solutions, I think the next step really is understanding the field. And the field is exactly what it sounds like. It's this broad-based land of consumers, advocates, providers, who are all involved with the issue of mental health in some way, shape, or form, right? So your first question is going to be, who all is talking about mental health? And I think what you'll find very quickly is you'll find consumers are talking about mental health, physicians and providers and nurses and social workers are talking about mental health, teachers, etc. What are they talking about exactly? Are they talking about the need for better insurance coverage? I know that Representative Kennedy talked about parity earlier. Is the issue that their insurance won't cover something? What exactly are they identifying as problems in the field? Have they done anything on this before, right? So that's the when. When have they done anything, right? If they have done some work in this, you want to know when. Was this 20 years ago? Was this 5 years ago? The when matters because what ends up happening is you get to reevaluate what the field looks like now and whether or not you can be helpful to it. Let's say there was an attempt to pass legislation last year, and you're interested in introducing that same piece of legislation. Well, you're not going to do it if it was just a year ago, because you're probably going to have the same players involved who were there a year ago. But let's say it was 10 years ago, you might have to really reevaluate the field about who's there now and whether or not we can make any specific changes. Right? How did they try to make the change, right? If you're understanding the field, you're also understanding what efforts have been done in the past that mirror the problem that I've identified and mirror the solution that I've identified, right? And you're trying to figure out with your solution, who's responsible for that? Is this something that the city can take care of, that the state can take care of, or that the federal government takes care of, right? When we talked about parity with Representative Kennedy, that was clearly a national issue. This was something that we needed the federal government to step in on and say, there must be parity between physical health and mental health. So now that we've got parity solved, right, and I put that in quotes, what you're seeing is sometimes a lack of parity on the state level. So then the question becomes, who do you now have to advocate to? Who's your regulatory agency who might not be ensuring that parity is looking the way it should look on the state level. So really understanding what the issue is, how you might solve that solution, if it's through legislation, regulation, ballot initiative, depending on what state you're in. That's a really big thing here in California. Really understanding where you might make some traction. One of my favorite stories about understanding the field is, I remember a certain constituent complaining about the mayor and how the mayor wouldn't do anything to better public schools. And this was a huge complaint from them. And I remember saying, yes, but the mayor in California isn't responsible for public schools, right? That's the school board. So really understanding who's responsible for what and at what level, and depending on where you live and what state you're in, you're all gonna have different responsibilities and a different structure. It gets simpler, on the national level. You have your representatives, you have your senators, you have, the different branches of the 3 branches of government, and that is simplified. But on the state and local level, it can actually get a little complicated on who's responsible for changing or implementing a particular solution. So really, again, just understanding the field, understanding who's been playing in this field, who's been successful, who hasn't been successful, and where are they now? Next slide. Coalition building. And this one is, I would say, probably the most important. And I think the first question is, what are you building coalition for? Are you building a coalition to implement a short-term strategy or a long-term strategy? And what do I mean by that? A short-term strategy could be something like, as soon as this initiative is over, we're going to wrap up this coalition and we're never going to contact them again, right? And maybe that is to get a ballot initiative passed. A long-term strategy is, this is our coalition and we're going to make sure that, kids in school have access to mental health services anytime they need, from K through 12, and there are 10 steps to get there. And this is more of a long-term strategy and long-term solution, right? So really figuring out, what are you coalition building for? What does your coalition look like? Is this a coalition that, is very engaged, meaning, everyone involved, you have their phone numbers, you can call them to, do a thing for you or to provide testimony for you or do something in that matter? Or is this a coalition that's a little bit less involved? One that, maybe just interacts through email or social media, et cetera. So really figuring out who your coalition is and how you'll use your coalition, I think is very, very important. Most places have coalitions already in play, depending on where you live. And it's always easier to join an existing coalition than to start your own. But if you are someplace where there is no coalition around the idea of mental health, then you could be the first one to start that and to really get people on board. One last thing that I'll say about coalition building is, I think that sometimes we think your coalition has to involve everyone who does the same thing you do, right? So if you are a consumer, you might build a coalition that only has consumers. And I think the most important thing, particularly around the state of mental health, is mental health impacts us no matter where we are. So a broad-based coalition actually would be the most successful. Businesses care if their workers have good mental health, right? Schools care if their teachers, staff, and students have good mental health. Physicians care if their patients have good mental health. This is really a broad-based thing that doesn't have to be limited to one particular group. One thing that I love about the organization that I work for, Children Now, is that we have something called the Children's Movement. And this movement says anyone, faith-based providers, small businesses, big businesses, people who work with kids, individuals, can sign on to this network and make requests of the state on how to do better for kids, right? That is a broad-based coalition of support. It's not limited to one kind of group. I think those are the most successful when we think about coalition building, because that way you have everyone talking in the same voice about one thing. Next slide. Communication. So, and I know that Dr. Patel talked about this very briefly on the power of storytelling, and I really can't stress this one enough. Stories are such a good way to get people interested, right? The problem with storytelling, and storytelling itself is not problematic, is you can't stop at storytelling, right? You have to tell a compelling story, and then you have to layer it on how this applies to the population that you're trying to help, right? So there's the individual story, and then there's the group change that you're asking for. And policies really are about focusing on population change, not necessarily on individual change. So how is that story a reflection of what a group is going through? That's how you want to think about your storytelling. You don't want to pick a story that's so obscure, that it's not really representative of what a group of people or what your students are going through. You also have to simplify the problem. I think the important part of communication is you have to really know who your audience is. Who are you talking to? There are some members, senators in California who are very well versed on mental health. They are mental health champions. I don't need to explain to them the importance of mental health, right? But you might have some policymakers who are not as well versed on mental health. And you do have to take a step back and say, why is mental health important? What is the problem that I'm seeing in my community? Here's how I want to fix it. And here's why that solution will actually fix the problem, right? Those connecting of the dots are just super, super important. Most individuals, most policymakers might care about mental health, but not necessarily see the bigger picture. One thing that I also like to do before I speak to anyone is know their history on, any moves or any policies they've done in the past on mental health. Did they run a bill last year? Did they implement some policy change? Did they sign on to a letter? What did they do in this field already? Because one of the worst experiences is sitting in a room with a policymaker and convincing them to do something, and they say, oh, I did that 3 years ago, right? So really knowing your audience, know who you're talking to, know what they've done in the field is going to really help you with communication. Simplify the problem. One thing that I did at in a previous life was I worked a lot on payment reform for physicians. That can get really complicated. And what I would do, particularly in my written materials, is I would write everything that I knew on a sheet of paper, and then I would redline it, because most of that information someone didn't need to know. They just needed to know the highlights. So I'd redline that and really give them a simplified version of what I was talking about. Now, if they wanted more detail, I could provide the detail, but you don't need to start there. Next slide. So what does this all mean? What are you leading up to, right? So you have identified the problem, you have identified a solution, you built your coalition, you figured out how to communicate about this issue. What next? And I've alluded to some things before, but really it can be as simple as just sending an email or a letter. Anytime I write a letter, I try to have some other groups sign on to it so that the policymaker knows that this is important, not just to my organization, but is important to all of us. You can call. I know that it's a little foreign for folks to call now in the social media age, but calling by phone, calling your member, saying, hey, you represent my district, or I live in this community, can also be really, really powerful. Schedule a visit. I know policymakers are very, very busy, and oftentimes you'll be meeting with their staffer, but legislative staff, administrative staff are very, very important to this process because they connect with the member, or they connect with the official and relay your concerns. So treat those meetings just as importantly as you would someone, with a big name. So schedule a visit, meet with their staffer, explain the problem, identify the solution, and try to get buy-in. Another thing that I love is providing public testimony. And public testimony really is just the process of going to a hearing, maybe a legislative hearing, and saying what you find to be problematic or what you find to be important about the issue at hand, right? Really being on record about where you stand is very important, because that all gets recorded and that all gets written down somewhere. So you want to make sure that your voice is being heard in that way. Developing relationships with decision makers, again, I think decision makers is a broad term. I think most of us think of decision makers as the folks that, we check on our ballot box and we put into office. And that is true. But there are multiple levels of decision makers, right? So most folks in the executive branch, we don't vote for, right? With obvious exceptions. But what happens is you begin to work with some key staff, some appointed staff, for example, right? So if you've got, someone who works at Health and Human Services Agency, or in California, the Department of Healthcare Services, you really want to think about who in those offices, who in those departments can make decisions, not only can make decisions, but who in those departments influence our decision makers. That's such a huge part of it. And I talked about legislative staff earlier, but it's just as important when we think about our departments and the staffers in those departments, because they're also relaying your concerns to those decision makers. So everyone is important, and everyone really has to hear what you have to say about what changes need to be made. Dr. Patel talked about social media engagement, right? And social media, again, can be a hit or miss. It can go very well for you or not. I don't always believe that social media is a reflection of what folks care about, right? I mean, have you ever tried to get a particular constituency or particular group to engage on social media? And it's been very difficult because, they are working during the day and they cannot, engage on social media in that way. Or there might be a gap in knowledge on how to use social media best. So it can really help you or not, but I wouldn't rely on social media engagement alone. Next slide. Yeah, so, I have a very long list of, what I can say are examples, but before I even go there, I think part of the issues that we just talked about here, the next step would really be thinking about how you measure success, right? So for most people, they pass a bill and then they move on. But the reality is, for folks like myself who work in the field, we have to keep watch. Is this bill being implemented in the way that we want it to be implemented? Are there any unintended consequences, right? In the issue of parity, I know in California, even though federal legislation was passed, we had some issues here where parity was not being realized in the way that we wanted it to be. So that means you have to revisit pieces of legislation, right? You have to revisit regulation. So success can be, longer than just doing this one thing. Most of us don't check a box and say, okay, we got this bill passed and then we've moved on. Really, the bill passing is the first step, right? And then we want to think about, how has this played out? How has this really impacted the constituency that I've been trying to impact? That is where a lot of the work comes in. So I know that bills are, and legislation tend to be talked about the most, right? But I always say that your regulations are so important because they are about how people experience these changes, which is very different from just simply implementing the legislation. You're really creating a construct around how people are going to experience the thing that you want them to experience. So really don't want to underestimate the importance of follow through and the importance of making sure that the work isn't done simply because you got one initiative through. In California, I can talk a lot about some of the work that we've done, particularly around children's mental health. But I will say that most of the work is a reflection also of what needs to happen nationally, right? I don't think that most of what we do is unique to California or even unique to kids on some level. But really understanding that that we need to build coalition around important issues. One of my favorite issues has been one around community health workers. And in California, we have had a legislative champion, Senator Bell, for years, thinking about community health workers and thinking about the role that they play in supporting mental health. Community health workers, peer supporters, people with lived experience supporting those with mental health issues. And we worked for years on this issue. And, we had a huge coalition around this issue, and almost every advocate was speaking in one voice about the need and importance for community health workers. And last year, we got a very important piece of legislation passed, SB 803, around the ability to create a slot for community health workers and an opportunity and space for them to serve those, so that they could have someone to talk to with lived experience and someone to talk to who was part of the community. And that's an initiative that, I was very proud of to be part of, right? That's a clear example of a coalition-led effort that was successful. The next step now is to see how that's going to be implemented and to make sure that our community health workers have everything that they need to best support communities. So, that's one example, and I'm not sure if I have enough time to continue, but I'll stop there for now and see if we're going to talk a bit more.
Thank you, LaShawn. Yeah, we've got time for a few questions that I'm going to ask to you and Kavita, but first of all, thank you. That was such a gift. I loved how you reminded us that mental health impacts us no matter where we are. It's so true, and it really underscores the reasons that I think you did what you just did in helping us understand how to take action with our advocacy. I think we're all better off because of you helping us see the ways that we can get involved. So many gems in your presentation, and I know people are going to ask this. Yes, we're recording it. Yes, we will put it online so you can share it with your friends and your colleagues. But you had so many gems there. There's potency in the power of story with data, which is a challenge for us and a massive opportunity, and the importance of a red pen. I mean, who would have thought about that? Like, highlight the sections that you really want people to pay attention to. So thank you for that. I really appreciate that. So I want to ask you both one question, and then we'll probably be at our time here. So Kavita, I'm going to come back to you first. Based on what you just heard from LaShawn, there's a lot of opportunities for each of us to get involved in advocacy these days. You're on the front lines of both delivery and policy. What gives you hope heading into a new Congress and a new administration? What are you most worried about? And based on maybe this conversation today, what ways do you think we as a collective community should be focusing our advocacy attention?
Yeah, great. And I'll be brief. I know we are short on time. The thing that gives me the most hope is truly the, at least for all things, the silver lining, if there can be said to be some in the pandemic, has been a much broader conversation about mental health. At the same time, I don't want that to somehow, sometimes when I see this happen in policy, it happens like people talking about access. It becomes sanitized in a way where we're like, oh yeah, mental health, pandemic. Oh yeah, mental health, twindemic. And you just don't process it. So coming out of this, and LaShawn, you're so good. I wish you could just kind of can that and rinse and repeat on many levels. Coming out of that, I do think that there's going to be an incredible attention on the first 100 days. I was looking at the participants. We've got superstars who are listening in. People are focused on the first 100 days because there's this momentum, there's this energy, there's this push. We should try to think about how to kind of be a part of that wave and offer, to LaShawn's point, data, concrete kind of red lines, if you will. And then I do think the stories, when used appropriately, help to solidify how that translates and makes someone on the other side, whether it be a senator or a congressional staffer, to say, yeah, I'm willing to kind of take this forward. And that's really the advocacy, right? It's easy when someone comes to you and says, I want to do something, just give me some support. Well, maybe not easy. I should say that happens often in a town like Washington. The harder is to switch it and turn on someone when they feel like a new Congress, new energy, new administration is coming. And then I'll say the third that's a challenge, which even we're navigating, is doing it all on Zoom. We hope to not be doing it on Zoom, but I will say that sitting down across the table with someone who you ideologically do not agree with, but share a cup of coffee with, makes a huge difference. It was everything that I did to try to make changes. We don't have that. So we got to double up on those key skills and metrics that LaShawn pointed out to make it effective.
Thanks, Kavita. LaShawn, let me just turn to you on the same question, because hearing Kavita, I have a feeling that you have an opinion on this too. what gives you hope, and what are the things that you're most excited about? And maybe collectively, what do you think we should be paying attention to in this coming year?
Yeah, it's going to sound weird. So I don't want this to sound weird, but I think what gives me hope is the pandemic has highlighted that everyone's mental health is important. I think for a very long time, we've been relegated to thinking that mental health is only something you need to talk about for someone with serious mental illness, right? And that was the box that we were put in. The pandemic is showing, yeah, obviously we have to take care of our folks with serious mental illness, but it's important that we are all emotionally well, right? So that we can handle stressful situations. That's been the silver lining to me, is that it has become just so much more important for everyone to think about how they interact with their mental health going forward.
Thanks to both of you for that question. I know we've got some questions and stuff coming in, and we're trying to figure out if we can unmute people to ask the question. So if I can figure this out, we will do so in just a second. Kritika, are we able to unmute people that have a question here? I know we're almost at time.
Yes, I can unmute the person who has a question.
Okay, it looks like we have a question or a hand raised from Patty Murray, and I don't know if this is Senator Murray. If it is, that's great. But Kritika, if you can find them and unlock, that'd be great.
Patty, you should be able to talk now. You might be on mute.
Might need to unmute there if you can. Okay, well, we'll see. If you can unmute, please join us in here and you can interrupt us all. There you go.
Hi.
We can hear you. Hi there.
Can you hear me? I'm sorry, this is not Patty Murray, the senator. It's Patty Murray, a sister with a traumatic brain injury, mental illness. Sorry, I'm on the streets of New York City listening to you.
Thank you. Would you want to offer up a question or insights here for us?
No, I've been listening and so wonderfully appreciating everyone and everything you're doing. And I accidentally hit a button. So
hey, it's okay. Sometimes
I'm so sorry for your time. Please move forward.
Oh,
and thank
no, it's
you.
great.
I'm listening and keep going. And thank you, everyone. Okay.
Thank you. And thanks for dialing in from the city of New York. This is great. Well, we want to close here today, first of all, with my thanks to my friends and my colleagues, Patrick, LaShawn, and Kavita. You guys are amazing. And we so appreciate your time and your sacrifice today and your service for what you've done. So on behalf of Wellbeing Trust and Inseparable, thank you. And thank you all for joining us. Our nation will be better if all of you get involved in advocacy, full stop. Our collective mental health is on the line, and it's really up to us to change that trajectory. For those new to mental health and new to advocacy, today may have been your first day understanding the importance of your voice. You've been challenged to take action. We've given you some of the tools. Service opportunities like advocacy exist every day in your communities. And with the knowledge from today, it's our hope that you will join us in this journey for change. On the screen here in front of you, you can see ways that you can get involved, follow up. But thank you for what you've done. Thank you for what you'll do. And inevitably, we're going to have the opportunity to impact on countless lives. So thank you and enjoy the rest of your day.